Dear students, welcome back. In the previous session, we have discussed about the carpometacarpal joints of the thumb. Now in this session, we are going to discuss about the MCP and IP joints of the thumb as well as the thumb musculature. So if you see this MCP and IP joints of the thumb, first we are going to discuss about this MCP joint of the thumb. So this joint of the thumb is the articulation between the head of the first metacarpal, so here this one, head of the first metacarpal, and the base of its proximal phalanx. And it is considered to be a condyloid joint, and it is having 2 degrees of freedom, and it causes flexion, extension, and abduction and adduction. So, and it is also having an insignificant amount of some passive rotation is occurring at this joint. If you see the functional contribution of this joint is it provides the additional range to the thumb pad in opposition and allow the thumb to grasp the contour of the objects. That means again it helps in the grasping around the shape of that object. So this is the main functional contribution of the MCP joint in the thumb. And if you see the motions at the first MCP joint, so as we know that it is having 2 degrees of freedom, that is flexion and extension, and abduction and adduction. And the motions in the first MCP joint are more restricted than compared to other MCP joints of the fingers. So only 50% of flexion is available at the fingers and little if any hypertension. In this joint, abduction and adduction are extremely limited in this joint. The metacarpal head is not covered with cartilage dorsally as well as laterally. So here this metacarpal head is not covered by cartilage dorsally. So this is the dorsal aspect of the hand. So dorsally as well as the lateral part. And it almost resembles the head of the proximal phalanx. So it almost resembles the head of the proximal phalanx, and it does not have any central groove for this bone. Okay, so here if you can see the ligaments, each in this joint also the ligaments which are same as that of the other MCP joints like capsular ligament, palmar, medial and lateral collateral ligaments are also seen in the MCP joints. Okay, the first MCP joint is reinforced extracapsularly. So that means over the extracapsular on its volar surface. On its volar surface means this one is palmar surface. So this one is reinforced by 2 sesamoid bones here. So an extra 2 sesamoid bones are present. So here you can see in the cadaver, so these are the sesamoid bones. 2 sesamoid bones are present volarly, which is reinforcing the volar aspect of this MCP joint, and these bones are maintained in positions by fibers from the collaterals. So here you can see the collaterals, fibers from the collateral ligaments, and also by an intersesamoid ligament. So these are the intersesamoid ligaments. So these ligaments maintain the position of these sesamoid bones. And some studies are done by Goldberg and Nathan. They propose that the sesamoid bones are the result of friction and pressure on the tendons in which they are embedded. They support this by noting that the sesamoids of the first MCP do not appear until 12 years of age, and that sesamoids in some investigations have been found in as many as 70% of 5th MCP joints and 50% of 2nd MCP joints. Okay, so this is about the MCP joints in the thumb. If you see the IP joint of the thumb here, the IP joint of the thumb is the articulation between the head of the proximal phalanx and the base of the distal phalanx. It is structurally and functionally identical to the distal IP of the fingers. So it is same as that of its structure as well as its attachments, same as to that of the distal IP joints of the remaining fingers. So this is about the MCP and IP joints of the thumb. Now we will see this musculature, the thumb musculature. So this thumb musculature also includes extrinsic thumb muscles and intrinsic thumb muscles. So if you see the extrinsic muscles, there are 4 extrinsic muscles which helps in the movement of the thumb. Out of 4, 1 is present on the palmar aspect or volar aspect and 3 are present dorsolaterally. So the volar muscle which is present, which acts on the thumb, is flexor pollicis longus. So this flexor pollicis longus is a deep forearm muscle. Okay, and this muscle is inserted into the distal phalanx, so distal phalanx of the thumb, and which is correlated with that of the flexor digitorum superficialis. At the wrist, the flexor pollicis tendon is covered by radial bursa. Okay, and this bursa which is continued with its digital tendon sheath. So we have seen the tendon sheaths of ulnar bursa, isn't it, for the remaining muscles when we are dealing with FDS and FTP. So on that side you will find the radial bursa. So that radial bursa which is covered this tendon of flexor pollicis longus. Okay, and the next muscles are, if you see on the dorsolaterally, you will find the extensor pollicis brevis, abductor pollicis longus and extensor pollicis longus. So these are 3 muscles which are located dorsally. So almost all these muscles are deep muscles. Okay, deep muscles or this extensor pollicis longus and abductor pollicis longus, all these are the deep muscles of the forearm which is coming out of this and which is getting inserted on the dorsolaterally. Okay, so if you see the EBP, that is extensor pollicis brevis, and APL, that is abductor pollicis longus, these 2 muscles run a common course. So these muscles will have a common course from the dorsal forearm crossing the wrist on its radial aspect up to their insertion. Okay, up to their insertion. Yes. Now the shorter extensor inserts on the proximal phalanx. So the EBP, that is extensor pollicis brevis, is going to insert on the proximal phalanx, whereas the long abductor inserts on the base of the metacarpal, at the base of the metacarpal. Okay, so these are the things we can find here. The extensor pollicis are going to insert in the proximal phalanx here, and the another muscle, that is abductor pollicis longus, which is going to insert on the base of the metacarpal, base of the metacarpal. So both muscles radially deviate the wrist slightly and abduct the carpometacarpal joint, whereas extensor pollicis brevis also extends the MCP joint. Okay, so both these muscles helps in radial deviation, whereas this extensor pollicis brevis also extends the MCP joint. If you see this extensor pollicis longus, EPL originates with the previous two muscles but courses around the dorsal radial tubercle, and it is then getting inserted into the distal phalanx. So this muscle is inserting into the distal phalanx. This EPL creates an extensor force at both IP joints, that means interphalangeal joints, as well as the MCP joints. So this muscle also adducts. So this muscle helps in adduction of the carpometacarpal joint. Okay, so if you see this abductor pollicis and extensor pollicis helps in the abduction, and this extensor pollicis brevis also extends the MCP joint, whereas extensor pollicis longus helps in extension of the MP and IP joints, and it is also helps in the adduction of the carpometacarpal joint of the thumb. So these are all the actions of the extrinsic thumb muscles. So if you see the actions of all these muscles, it mainly depends upon the wrist position, which is the essential factor in providing optimal length tension for the extrinsic muscles of the thumb. The flexor pollicis longus is ineffective. Flexor pollicis longus is ineffective as an IP flexor in wrist flexion. Okay, if wrist is flexed, so then at the interphalangeal joint it is having not effective action at that place. So if you see the EPL, that is extensor pollicis longus, cannot complete the IP extension when the wrist, carpometacarpal joint and the metacarpophalangeal joints, all these three joints are simultaneously extended. Okay, at that time what it requires means the abductor longus as well as the extensor brevis requires the synergy of an ulnar deviator of the wrist to prevent the muscles from creating wrist radial deviation. Thus, it affects their ability to generate tension over the joints of the thumb. So, these are all the actions of this extrinsic thumb muscle, and which case these muscles are ineffective and which case it is effective. It mainly depends upon the position of the wrist. Okay, so now we will move on to the intrinsic thumb musculature. Yes, so there are four thenar or intrinsic thumb muscles that primarily take origin from the carpal bones as well as the flexor retinaculum. So the muscles are apponens pollicis, abductor pollicis brevis, flexor pollicis brevis, and adductor pollicis. Okay, so if you see the apponens pollicis is the only intrinsic thumb muscle to insert on the first metacarpal. So here the metacarpal is present and this is the only muscle which insert on the first metacarpal, and its action line is nearly perpendicular to the long axis of the metacarpal and is applied to the lateral side of the bone. So the apponens pollicis is very effective in positioning the metacarpal in an abducted, flexed as well as rotated posture. The abductor pollicis brevis, okay, and flexor pollicis brevis and adductor pollicis insert on the proximal phalanx, and the name of their action is present here. Okay, so, and another very important thing, the flexor pollicis brevis is having two heads of insertion, and it is having larger lateral head and medial head. The larger lateral head inserts with the abductor pollicis brevis and also applies some abductor force. And this flexor pollicis brevis crosses the sesamoid bones at the MCP joint, which increases the momentum for flexion. Okay, that means this lateral head which is crossing over this sesamoid bones. So the sesamoid bones are present olarly, so it helps. So because of the sesamoid bones which are present olarly, so the moment arm of this tendon increases, which causes flexion. So whereas the medial head of the flexor inserts with the adductor and assists in adduction, thumb adduction. Okay, so the main function of these thenar muscles are, these are active in most of the grasping activities regardless of the precise position of the thumb. Okay, the opponent's pollicis works together most frequently with abductor pollicis brevis as well as flexor pollicis brevis, although the intensity of the relationship varies. So the intensity of the muscle contraction, whatever may be the intensity, the opponent's pollicis is going to work with these two muscles. Okay, when the thumb is gently brought into contact with any of the other fingers, the activity of the opponent's pollicis predominates in the thumb, and abductor pollicis brevis activity exceeds that of flexor pollicis brevis. When opposition to the index finger or middle finger is performed firmly, activity of the flexor pollicis brevis exceeds than that of the opponent's pollicis. Okay, with firm opposition to ring and little fingers, however, the relationship changes. Opponent's pollicis activity increases with firm opposition to the ring finger, equaling the activity of the flexor pollicis brevis with firm opposition to the ring finger. Okay, so likewise the opponent's pollicis activity is varying from opposing the fingers to index finger, middle finger, ring finger and little finger. So whatever may be the thing is happening, the opposition is taking place, and this opponent's pollicis is working with that of abductor pollicis and flexor pollicis brevis, isn't it? So that means for the ring finger, so the activity of these two muscles are varying. Okay, and finally when it reaches to the little finger, the intensity of the opponent's pollicis is equal to the flexor pollicis brevis. Okay, such kind of work is carried out by this opponent's pollicis. Okay, the change in balance of muscle activity with firm opposition and with increasingly ulnar opposition can be accounted by the increased need for abduction and metacarpal rotation. For this apposition, so it requires abduction and metacarpal rotation. Increased pressure in apposition additionally appears to bring in the activity of adductor pollicis. If there is any pressure increased in apposition, then adductor pollicis is going to add up. Okay, so next, the adductor pollicis stabilizes the thumb against the opposite finger. In the firm opposition to the index and middle fingers, adductor pollicis activity exceeds the very minimal activity of the abductor pollicis brevis. With more ulnarly located position, the increased need for abduction result in simultaneous activity of abductor as well as adductor is taking place. Okay. Next, activity of the extrinsic thumb musculature in grasp appears to be partially a function of helping to position the MCP and IP joints. Okay, and these extrinsics main function is in returning the thumb to extension from its position in the palm. That means a reposition. So opposition and reposition is there, isn't it? So the reposition is essentially an extrinsic function, but it has been found to include some opponent's pollicis and abductor brevis activity. Okay, so this muscular activity would assist in maintaining the thumb in abduction and in maintaining metacarpal rotation, which facilitates the next move of thumb back into opposition. So these are all the variations of this intrinsic thumb musculature during different activities. That means when thumb moves to ring, index and middle and little fingers, what are the muscles are involved. If the pressure of the opposition increases, then adductor pollicis is getting involved. So after opposition, it has to come back to its original position. For that, extrinsic thumb musculature is helping to reposition the thumb along with opponent's pollicis and abductor brevis activity. So these are all the actions of extrinsic and intrinsic thumb musculature on CMC, MCP and IP joints of the thumb. In the next session, we are going to discuss about the prehension. Thank you.